Tell me exactly what happened.
My head hurts. I have trouble with depression, and I got a bad migraine, real bad migraine.
And how old are you?
39.
Okay, just 1 second for me. Is your breathing normal for you?
Yes, ma'am.
Was the headache a sudden onset of severe pain?
The headache, the migraine is about a 6 right now.
Okay, and did it come on suddenly or gradually?
It came on gradually.
Okay, and do you have any numbness or paralysis?
No, ma'am, depression.
Okay. Okay, the system suggests it might be most appropriate for you to speak with a registered nurse, and together we can determine what is most appropriate to meet your healthcare needs. Please remain on the line while I get her on the line, okay? I have a caller on the line seeking medical assistance. He has a history of migraines and some depression.
Okay, my name is Susan and I'm a registered nurse. We're going to go through some questions to see if there may be more appropriate care for you rather than going to the ER by ambulance, okay?
Yeah, I don't know what to do. I'm not from around here. I don't know where to go. My migraine is about killing me.
Well, I'm going to help you. So let's go through these questions and we'll figure out what the best care is for you, okay?
Yes, ma'am.
Your last name is...
Yes, ma'am.
You're by yourself?
Yes, ma'am.
Okay. You got a house that you're at?
Yes, ma'am.
Okay. What is your date of birth? What kinds of medical problems do you have?
Just migraines, and I'm lost in the depression.
Are you allergic to anything?
No, ma'am.
Do you take medications daily for anything?
No, ma'am, I don't take no medications.
Have you taken anything for your headache?
Just over-the-counter Tylenol and aspirin.
I'm sorry, Tylenol or what?
Tylenol or aspirin.
Oh, aspirin. Okay.
You get it over the counter at the pharmacy.
Okay, very good. How long have you had the headache?
The headache came on just about an hour ago. I failed a class, a course at school. I'm stressed. I've been stressed over it real bad. I need to get in for depression. I had depression before, real bad, and I overdosed about 3 or 4 years ago. I need to get in and get back on depression medication so I can finish my school this year.
Okay, I understand. Did the Tylenol or aspirin help any at all?
No, ma'am.
Okay. Do you have any other symptoms?
No, ma'am.
Okay. Have you passed out or lost consciousness?
I've just been tired from the headache. My nerves are just real bad. I've been stressing over school.
Have you had any pain around your eyes?
No, back of my head and then on the side.
Do you feel you have a fever or feel feverish?
No, ma'am.
Okay. Have you had any head trauma in the last couple of days or weeks?
I got in a wreck on my bicycle a few weeks ago. I hit my head, but it weren't too hard.
Have you had any vomiting?
No, ma'am. I'm nauseous, though.
Okay. Is the headache dull or aching?
It's a migraine. It's getting worse.
Are you having trouble sleeping?
Yes, ma'am.
And you said you weren't from here, so you don't have a doctor here?
No, ma'am.
What kind of insurance do you have?
I don't have no insurance, ma'am.
Okay. We're going to recommend that you go to Foothill Family Clinic rather than to the emergency room. They'll be able to see you and help you with your headache and depression. So they'll also be able to help you with a follow-up physician so you can get established. And even though you don't have any insurance, they'll be able to work it out with you and help you.
All right. Now, where you want me to go?
Foothill Family Clinic. Do you know where Foothill Family Clinic is?
No, ma'am.
Oh, okay. Well, first of all, do you have a way to get there?
No, ma'am.
Do you have any money for a cab or bus?
No, ma'am.
I'm going to send a cab for you to take you to the clinic. MedStar will cover the cost, but you're going to need to find a ride home. And the bus runs right by there. You should be able to get on it. The clinic will get you to the right place for your migraine and for your depression. They have a psychiatric ER upstairs on the 10th floor that deals with depression and anxiety, and they'll be able to help you. So I think that's the best place for you, okay?
Thank you, ma'am.
You're welcome. Now let me confirm your address again. You're at...
Yes, ma'am.
And your number is...
Yes, ma'am.
Is that a cell phone you're on?
Yes, ma'am.
Because I'm going to call you back. I'm going to call the cab, and I'm going to see what time they will come. They usually come within about 15 or 20 minutes. So are you ready to go?
I'm sitting outside.
Oh, so you can watch for them. Good. Good. Okay. I'll call them, and then I'll call you right back and tell you what time they will be there.
Okay, thank you, ma'am.
You're welcome. If you get worse before I call you back or have any worsening symptoms, please call back on 911, okay?
Yes, ma'am.
But I'll talk to you in just a few minutes, okay?
Yes, ma'am.
Thank you.
Thank you, ma'am.
Bye.
Bye.